Alright, so I'm on my way home, stuck in this Atlanta traffic, and wanted to share a nursing joke with you. Alright, so there's this psychiatrist, and he's seeing a patient, and he's doing a physical exam on the patient, and he asked the patient to take off his clothes, so he takes off his clothes, and this psych patient has saran wrap all around his groin. And the shrink says to the patient, "Well, I can clearly see your nuts." Sorry. I will tell you here, so here's another joke. When I first started working as a nurse, so I'm on my first nursing job, and I'm on a ICU step-down unit, and the nurses there were pretty experienced. It was very intimidating, and I just knew sooner or later someone was going to try to test my knowledge about something. So I remember this guy, his name was Richard Carroll. He had been nursing since 1978, and I remember that because that was the year that I was born. And he says, he comes up to me with a serious face, and he said, I got a question for you. I said, oh, here we go. I'm ready. He says, what's the difference between an enzyme and a hormone? And I was just like, oh my goodness. I said, first of all, what did I miss? Because I'm thinking of all the patients that we were working with, I don't recall anything dealing with enzymes or hormones with any of my patients. Was it something I was supposed to check? What was going on? And I had that puzzled look on my face. And I'm sitting here thinking, okay, so what is the difference between an enzyme and a hormone? I remember this from nursing school. And he just looks at me, he says, you can't hear an enzyme. And I just looked at him, I was just like, what? And everybody starts laughing, and I said, I don't get it. He says, you can't hear an enzyme, but you can hear a hormone. And from that day on, I just knew Richard was the jokester. So, alright, those are my 2 bad nursing jokes. However, I want to hear your best nursing jokes. So reply, let me hear some of your nursing jokes. Hopefully they're a lot better than mine. Alright, talk to you later.